A 67 years old man is diagnosed as having 7 centimeter infrarenal abdominal aortic aneurysm. What is the likely risk of rupture over 5 years? So a patient it is large, which is about 7 centimeter abdominal aortic aneurysm. So what is the chance of rupture of this aortic aneurysm? Here the options are less than 10%, 20%, 25%, 75%, and 35%. So what may be the option? So let's see the abdominal aortic aneurysm. First of all, the abdominal aortic aneurysm. The abdominal aortic aneurysm usually infrarenal. That means this is the renal pedicule. That means the renal artery and renal vein. So just below the renal artery and renal vein, this zone are the most commonly site for the abdominal aortic aneurysm, and this aneurysm may rupture if is the untreated. Sometimes the aneurysm may develop in the upper part also. And here we can see the rupture aneurysm. So the risk of abdominal aortic aneurysm rupture over 5 years. So first of all, here we can see the 5 centimeter to 5.9, 6 to 6.9, and 7 centimeter and above. So it is very important to remember all the percentages when there is the diameter is 5 to 5.6. In this condition, the risk of rupture in the next 5 years is 25%. But when it increases from 6 to 6.9 in this condition, the risk increases to 35%. But when it is 7 or more than 7 in this condition, what happens? It is 75%, which is more, which is actually it is a larger scale. That means when it is unlucky 7, when it is unlucky number, that means the 7. So in this condition, the risk of rupture is 75%. But when it is 6 to 6.9, it is about 35%, which is half. And also when 5 to 5.9, it is only 25%. So this percentage we have to remember by any cost. But remember, you can call 7 is unlucky. So in case of the unlucky, it is more, which is 75%. But when it is from 6 to 6.9, then 7.5. When it is 5 to 5.9, then 25%. Aneurysm greater than 5 centimeter is diameter, ultrasound should be formally assessed. So when aneurysm is more than 5 centimeter, the follow-up should be ultrasound. It should be done by the ultrasound, not CT scan. It is the ultrasound. Using CT scanning with arterial phases to deline the anatomy and facilitate surgical planning. But when we are going for the surgical planning or treatment planning in this condition, we should check by CT scan. So ultrasonography and CT scan, they both, ultrasonography and CT scan, they are both the investigation for the aortic aneurysm, but ultrasound is usually done for the screening purpose, but CT scan is done for the treatment purpose. So when it is 7 centimeter or more than 7 centimeter, that means the unlucky number. In this condition, it is more, which is the 75% risk of rupture of the aortic aneurysm within the 5 years.